I've wanted to do this job ever since I was 7 years old. I was just fascinated by how the human body worked, and I was also fascinated by mechanical things. I always knew that I had sort of an aptitude for that kind of stuff, and through the years playing sports and seeing athletic injuries myself, and that sort of started pointing me in certain directions. My name is Miltiadis Zgonis. I am an orthopedic sports medicine surgeon here at Penn Medicine. Obviously, I'm very interested in working with athletes. It's a major focus of what I do, but I think the type of surgery that I do really lends itself well to really focused, targeted soft tissue joint problems, specifically the shoulder and the knee. And so that's where I operate predominantly, doing arthroscopic procedures. I think calculated 92% of our surgeries are arthroscopic in nature, or at least include the arthroscope. So typically minimally invasive approaches to soft tissue problems. I see so many different types of patients, and they all are typically active folks that are dealing with some version of a joint abnormality that could be an acute injury. Really, we're looking at trying our best to diagnose the joint problem, the soft tissue issue, if there is one, and figure out what the real approach is. So diagnosis is the most important thing that we do. Some of the things that we deal with in sports medicine are very subtle. It could be a loose body in someone's knee, it could be a cartilage issue, it could be a meniscal problem. That's not always immediately apparent, and so we use a lot of advanced imaging, MRI, some CT, but mostly those types of things to identify the problem, and then the treatment plan typically falls into place pretty readily after that. The care of the athlete is really, in some instances, a psychology session as well as it is an anatomy session and an anatomy lesson. It's a period of time where we have to acknowledge that a very significant chunk of someone's life has been altered. The impact that that has on that person is well understood by us, and so at the end of the day, our main goal is to make sure that people feel comfortable, that they know that they're in the right place. And if they're not in the right place, that we will help them be in the right place. At the end of all of our sessions, we just want to make sure that people understand that we know that this is a big deal to them and that we are with them every step of the way that we can be.